Welcome to the Lifestyle Medicine Update. I'm Dr. James Meschino. Approximately 1 in 5 adults suffers from irritable bowel syndrome, which is a disorder that can cause chronic abdominal pain, gas, diarrhea, bloating, constipation. And a high percentage of these people also have either sleep disorders or anxiety or depression or severe fatigue. As such, it can be very debilitating. So there's sort of these standard shotgun dietary principles that are sort of recommended to these individuals to limit or eliminate foods that tend to cause diarrhea, gas, bloating, like foods that contain caffeine and alcohol and carbonated beverages, dairy products, foods high in sugar, fatty foods, gas-producing foods like beans and cabbage and broccoli, and avoiding certain artificial sweeteners like sorbitol and xylitol found in sugarless gum and sugarless candy. And sometimes to reduce constipation, you suggest you add some dietary fiber and drink plenty of water, do some exercise. But for other people, adding that fiber actually makes them worse. But you want them to drink more fluids, as a rule, to have urine that's very light yellow or almost clear like water. And to reduce in the diet some of the resistant starch that you eat. So, because resistant starch isn't digested as well by your body, so it can produce gas and bloating. So limiting foods that are, like potatoes and bread and cereal sometimes helps. And limiting your fruit intake to maybe 3 portions a day, making sure that you eat slowly and have meals in a quiet, relaxed environment, and don't skip meals. You want to have a more relaxed state when you're eating, and you don't want to be skipping meals. You might want to consider ingesting probiotics, these friendly bacteria that help to improve sort of digestion and elimination, maybe trying digestive enzymes with your meals to improve the digestion process. So these are sort of the general shotgun recommendations that practitioners make. But the really exciting news now is that Yale researchers showed recently that it's now possible to identify specific food sensitivities and provide patients with a more personalized dietary approach to the management of IBS, which has been shown to produce significant improvement in IBS patients. So the study was published in the British medical journal Open Gastroenterology in March of 2018. So using what's called the leukocyte activation test, or the Lcat test, which is just a simple blood test that examines the white blood cell inflammation response to certain foods, researchers showed that it's now possible to identify foods to which an IBS patient is most sensitive. And eliminating those foods from the diet was shown to significantly improve IBS symptoms in patients who eliminated foods from their diet that were identified on the Lcat test. So how was the study conducted? Well, the Yale researchers conducted a double-blind randomized clinical trial of 58 patients with irritable bowel syndrome. Now, for each individual, the researchers collected blood samples and used the Lcat test to measure immune cell activation in response to individual food challenge. So the study participants were then put on individual diets that either restricted foods consistent with the test results or restricted foods that were inconsistent with the test results. Now, after several weeks on the individualized diets, participants were assessed for IBS symptoms and quality of life, and the research team found that while both sets of participants experienced improvement, the individuals on diets consistent with the test results fared much better overall in terms of symptom severity. So the bottom line appears to be that if you suffer from irritable bowel syndrome, you may want to ask your doctor to perform the simple Lcat blood test to see what foods you are most sensitive to. The Yale research indicates that it may make a very big difference to your comfort level and your quality of life. So I've included a link to the research paper below in case you want to share this information and this research paper with your health practitioner and also read it for yourself. So thanks for watching, and I'll see you next time.